Do you see it?
Yeah, or no, get it. Okay, sorry. Oh.
See it?
Oh, yeah, I see you.
Oh, yeah.
I didn't see you do anything.
Oh, okay. Cool. You're on, Kristen. So, what's up, Chels? So, Kristen, you should have something that will prompt me to invite you or accept your request to join via video. Is there anything on your screen? Chelsea, I was at the clinic today. Where were you? Okay. All right, so I hit accept. Here we go. There you are. Hey.
See me? Hi.
Hey, what's up?
How are you?
Oh,
I might need to
good.
put my glasses on for this.
Yeah, smart, you know. I just got out of the shower.
Hey, at least you showered. I put some dry shampoo in my hair.
Oh, no, I did that last night.
Yeah.
Awesome. Chelsea is another PT. Hey, Chelsea.
Hi,
I'm gonna wave you, Chelsea. There you go. And then Juan, I think, Juan, correct me if I'm wrong, I think out in California, I think I met you at Fresno, right? Type a little something there, Juan. So what I'm going to do is, cool. We'll kind of get started. Let me get logged on here. There we go. Cool. All right. Cool. This is fun. So,
Do I have to join so it's going on my page too, or?
That is a good tester. So I joined from my phone, so I can see us.
Oh, and you're on your laptop?
So I'm on my iPad.
Okay. I'm on my phone.
And then that kind of creates a snowball effect from what we learned last time. So,
okay.
But yeah, cool. So topic of the month is pregnancy and return to training or CrossFit or whatever exercise that you may or may not have been missing out while the trimesters were occurring. So just wanted to give you guys a little bit of an intro. This is Kristen. Kristen is a local physical therapist. She is working and starting to specialize a little bit more into pelvic health, women's health, probably a little bit of men's health down the road. So very knowledgeable. In fact, when I was a student in physical therapy school, oh gosh, Kristen, it was probably like 8 years ago when my rotation happened. So Kristen was, helping me become who I am today. So, so we reconnected a couple of days ago. So she'll be joining us today. Yeah, definitely. Yeah. So yeah. As far as pregnancy and training goes, I personally worked with a couple of athletes at the CrossFit Pine Bowl gym, which is where my office is located. And my athlete slash colleague, Eva, we started to become more proactive during her second pregnancy. So she started seeing me once a month. At the beginning, it was like in every other week because she started developing sciatic pain, and she had that previous sciatic pain down her leg during her first pregnancy. So it kind of snowballed into literally within 2 visits that sciatic pain was gone. And she was still able to continue and modify her movements while she was performing CrossFit. So as the belly grew, we clearly had to modify what you would see in the gym, your conventional deadlift, meaning your feet are directly underneath your hips and you lift that barbell from the ground up to the hips. So as her belly was growing, we had to just widen her stance a little bit. And then there came to a point where Eva was, it was just becoming a little bit uncomfortable for her to get into that deep squat position. She could still do the deadlift movement, but as you're pregnant, and you can obviously vouch for this, Kristen. I've never had children before, but the joints becomes more relaxed, and you kind of like lose your sense in space and knowing where your body is. So the other modification that we did for Eva, so we still continued a wider stance deadlift, but then we added 2 45-pound plates on either side to create like a floor riser. So we brought the floor up to her, so it shortened her range of motion as she lifted that weight. So I thought that was pretty cool. And like, she was still pulling, let's see, her deadlift was almost 300 pounds prior to pregnancy. And she's like built like me. We're literally like split image of each other. And I think at that time when I filmed a little bit, which I'll be sending out some videos in the next couple of weeks of her doing that, I think she was pulling about 155 or 175 from the floor. So by all means, there's nothing wrong with lifting heavy while you're pregnant. So have you ever gone through any experience like that with your pregnancies, Kristen? What are some things that you had to do personally to modify in order to keep yourself in the game, right? Because pregnancy is not an illness, right?
Right.
And I read a recent article that I posted on the Facebook page that, yes, we want to do aerobic activity. That's super important, right? But the research does not talk about the anaerobic portion, so i.e. resistance training, right? So they're kind of poo-pooing on that, and literally there's like no research out behind that. So what are some like personal things that you went through, and maybe you were staying proactive during your pregnancy that kind of kept you in this nice strength phase in order to have the pregnancy that you did, either vaginally or cesarean? You kind of want to hit on that a little bit.
Sure. So I have 3 kids, and I was in pretty good shape before my first one. And so my first pregnancy was pretty easy. And then labor and delivery was easy. I was lucky. But then I got pregnant 4 months later with my second child. And so my postpartum period was super short. So I never really recovered. And then, 9 months after that, here I am with 2 kids. So I didn't really then have much time to do anything anymore. And then, unfortunately, I kind of let things slide for a while. And then I had my 3rd kid. And that's when my body pretty much paid for not staying fit. So I wouldn't do what I did because I did with my 3rd pregnancy end up with diastasis and some pelvic floor issues. So I think for some things that are just important for pregnant women that are going to be doing CrossFit, especially when you start getting into the 2nd trimester and your belly's starting to grow, to make sure you know how to breathe correctly. So, and that's going to help to manage pressure in your core. Also, just listening to your body and knowing when it's time to start modifying. Sometimes in the 2nd trimester, it might be time to start getting away from single leg activities, if you're starting to have any of that pubic symphysis pain. Or maybe not, some women can go through their whole pregnancy and not have to modify much, but I think it's important to know what to look for too, and to know what symptoms to look for. So like with a diastasis, you want to be mindful of, are you feeling any pain in the front, like in that linea alba area? Are you feeling any pain there? Are you feeling that it's starting to pull apart? You might actually sense that. Obviously, that would be a good sign to start modifying. Are you starting to feel pain or pressure down on the pelvic floor? A lot of women can develop prolapse during pregnancy, and often bearing down or not having proper pressure management in their core. So, you know, being mindful if you're starting to have those symptoms. What else? Are you still there, Amy?
Okay, there we go.
And you still there? I can't hear you now. Amy, I can't hear you. I can't hear you. No. Okay.
Okay, we had a little mishap here. Sorry. All right. Hey Kim, can you hear me? Can you give me a thumbs up if you can hear me, Kim? Hey Kim, can you hear me? Okay.
We're back.
Okay. Oh my gosh.
We're back.
All right, cool.
I don't know how much you got of what I said.
Yeah. Sorry about that. I think the last thing
That's
that
okay.
I heard was like pelvic floor pain, and then we were talking about diastasis or diastasis recti. So maybe kind of just kind of touch on what that means, like, you know, clearly where the six pack kind of comes in.
Yeah. So every pregnant woman is going to have a diastasis recti. It just has to happen in order for your belly to grow. But where it becomes an issue is if you're doing exercises that require a lot of front loading, like planks or pull-ups or even like weighted squats, you want to watch out, watch yourself in the mirror and watch out for what we call doming. So if you're doing these exercises and you notice that your rectus area, the six-pack area, kind of looks like a loaf of bread, kind of puffing out a little bit, that's called doming. And that just means you're not managing pressure appropriately in your core, which can lead to a much harder time healing from that diastasis postpartum, but it also contributes to pelvic floor issues. So, too much pressure down on the pelvic floor, if you're bearing down with any heavy lifting, can contribute to prolapse, which is, not fun. If you can avoid getting prolapse, then you should. And you avoid that by listening to your body. So if you're starting to feel that heavy pressure down through your pelvic floor, then it's time to modify. Or if you're starting to experience leaking, if you're peeing when you do these exercises, then it's time to start modifying. And then, of course, if you're having pain with anything, time to modify.
Right. And it's funny because that article that I posted on the Facebook page with the one student physical therapist interviewing a PT, a pelvic PT, she was talking about with the breathing, when we inhale, she talks about the pelvic floor acting as an elevator. So it has to go all the way up to the top and then all the way down past the basement, like into the foundation. So you think of the pelvic floor as we breathe. When we inhale with our chest and our belly, things get bigger in order for things to move, right? So that means the pelvic floor has to go down or descend into the basement or a little bit lower into the basement. And then when we exhale, right, that pressure has to be pushed up in order for us to exhale that air out. So that means that pelvic floor needs to rise up to, the top of the Empire State Building. Mm-hmm. So I think that goes hand in hand too, is not only learning these maybe low grade diaphragm type breathing techniques, which if you see a PT, we can definitely help you guys with that. Mm-hmm. And we can totally post a video on how to do that as well. But carrying that over with different types of movements, practicing that while you're walking, practicing that while you're washing the dishes, practicing that breathing while you're holding the baby, mm-hmm. right? So,
and practicing it while you're exercising too, exactly. Right? Of course. Your pelvic floor is lifting when you exhale. You would want to exhale on the hard part of the exercise. So if you're doing like a single leg or a single arm, like overhead press, then you exhale on the overhead press, or with a weighted squat, you exhale on the lift. Right. So that will help protect your pelvic floor.
Right. And another cool thing too, Eva just joined. Hey, Eva. When I was working with Eva during her pregnancy, so most of her, I think she started with me at like 20 weeks. Correct me if I'm wrong, Eva. So we started PT being proactive at like 20 weeks, and she maybe was utilizing like a corset or like a belly belt, but for sure, she started utilizing that belly belt, especially into the third trimester, right? Because things are getting all nice and conformed and getting real tight around the growing fetus, right? So the support of the belly belt, I think, also probably most likely provided Eva some feedback to help with the breathing too, right? Because if the belt was too restricting, then she wasn't getting that much air, which then would jack up her heart rate, right? Because we don't want a super high heart rate when someone's pregnant working out because of changes in blood pressure. You can get a quick, what we call it, like a drop attack, which then not only affects the mother, but the baby as well. So, but I totally vouch for like these belly belt supports, systems type deal. And so Eva said yes, at 20 weeks we began physical therapy, and kind of coming in every other week at the beginning. So and another thing too, to stem off that belt, like the postpartum period. So I think Eva, you can try, I want you to try to see if there's something on your screen where you can maybe join in via live video. See if there's anything on your screen, Eva, and then we can like converse back and forth instead of like typing. If you want to, you don't have to. But when Eva, so Eva literally comparing her two pregnancies. So her first pregnancy, she had a C-section. And she wasn't like proactive really at all as compared to the second pregnancy that she went through. And it was like a complete like night and day with the second pregnancy, but she had to have another C-section during the second pregnancy. So not only having that C-section, you know, is where they kind of cut through the lower portion of the ab muscles in order to birth the baby. But that utilization of that belly belt that Eva used towards the latter part of her trimester and then into the postpartum period, I think was a big game changer for her. I think she's trying to connect in and it won't let her. So yeah, I think that's another thing that will help with the breathing aspect too, and create a sense of safety environment for the growing fetus and the mother. So,
what does this belly belt look like that you're referring to? Like, how big is it? How much landscape does it take up?
So Eva, I believe, had two. One that was maybe about like 4 to 6 inches, and then the one after pregnancy kind of was like almost like a whole ab. Pretty close. So because she did last time, actually she just came in yesterday. We didn't check her diastasis, but the time before for PT, I believe she was only 2 finger breaths, which is like the normal.
Yeah, so yeah, that's still pretty normal. How far postpartum is she?
Let's see. Eva actually goes back to work, so she's like 3 months now, I would say.
Yeah,
Eva.
that's still pretty normal. And with the diastasis postpartum, it's not as important as how wide that is, but it's more important how firm it is. So it can be 2 to 3 fingers wide, but if you can get a good like transverse abdominis contraction under it and really sink your core and have good core pressure management, then the width is not as important as the depth. So if you can stick your fingers down into that 2 inches and it's squishy and you're going all the way, then that's not good. But if she can contract that transverse and make it nice and firm, then that's a functional diastasis, and that can still get better too, and probably will.
Yeah, good to know. Definitely.
Yeah.
So, cool. So that's definitely some things that can and should be recognized and a little bit expected during pregnancy and training, and pregnancy in general, because you will get those ab separations. Another thing too, maybe kind of jumping to the intensity level during pregnancy and training during that period. I totally 100% believe that, you know, I've read a couple like CrossFit articles regarding pregnancy and training, and I think that if someone is accustomed to already performing CrossFit and they've been, you know, I would say minimal 6 months or more doing CrossFit and they're fairly knowledgeable about the basics, then I 100% vouch that they should totally continue that. Like, they should be a little bit knowledgeable that, hey, this particular movement I know, but then I know how to modify this, right? Mm-hmm. As opposed to someone who just jumps into CrossFit and just starts rocking and rolling, and they don't have someone there like you or I who is a healthcare provider and like we do this stuff. They don't really have anybody to turn to. So as far as intensity goes, if someone is knowledgeable about pre-CrossFit stuff, then varying that intensity is super important, because, you know, you want to continue to stress that anaerobic system, that quick system, i.e. resistance training. So I posted a little while ago on the RPE scale, so the rating of perceived exertion, and this can go for everybody. This isn't just someone who's pregnant, like,
Mm-hmm.
gotta use this scale. But I think throughout that pregnancy, that individual needs to think of that RPE and knowing where their level is. And another great test for that not only is, because my 5 intensity is going to be different than your 5 intensity, right, Kristen? And
Yeah.
I'm sure when you were pregnant, it would have been way different, right?
Yeah.
So, a simple thing such as the talk test. If you're working out and training while you're pregnant and you are like, I can't even talk because my heart rate's going, I need to get air, that's too high. It's the intensity level is too high.
Yeah.
So you need to bump it down, calm down, get that heart rate down, and get that breathing under control in order to know and mentally take a note of your intensity level, right? And then knowing what specific exercise you were doing with that. So that when it comes up again, you need to take that and recall that thought and feeling.
Yeah. So, two things. I think, I think exercising during pregnancy is amazing. It has so many benefits to mom and baby. So, whatever form of exercise you can do, you should do. And for CrossFit women, if they've been doing it for however long, keep doing it until your body tells you you can't. As far as exercise intensity, there is some research out there that says pregnant women should exercise at 50 to 75% of their max VO2 max. And they said that VO2 max and then that like perceived rate of exertion is the same, right? So your 50 to 75% of your perceived exertion is where you should be exercising when you're pregnant. Right. So what would you say that would be, like like 5 to 7, like on your scale?
I would say on that modified Borg scale of that photo that I printed, I would safely say that 7 would probably be that max end range.
Yeah, based on that.
Right, definitely.
Yeah.
And so one thing that Eva had when she was training was her iWatch. So she always had her iWatch on. And she would constantly kind of like look at it, to kind of check her heart rate. Yeah. But we know during pregnancy that heart rate can be skewed, right? Because of the changes in blood pressure. So that's why from the research that I was looking at, that it's going back to that RPE scale and knowing your effort. I think heart rate's good. That way like your range, right? Your 50 to 70% range, and like Eva probably knew her range. So, and then she just obviously correlated that with her intensity. With the movements that she did. But so definitely monitoring intensity. Can you talk while you're working out? If you can talk comfortably, or talk and then not talk for like 30 seconds or so, or up to a minute, that's probably a good high intensity area you need to be at. But you shouldn't be going all out, like balls to the wall, can't talk, I'm about to pass out, like, So, I mean, I don't even do that, and I'm not even pregnant, like. So,
right.
So definitely, so we have intensity level, awareness of the growing abs and separating, how that's normal. We totally show people down the road on how to check that themselves, perhaps. So we can definitely post something on that.
It's normal, but you can make it worse, right? If you're not, like, so it's going to separate, it's going to separate, but if you're not aware of how to breathe or aware of how to manage the pressure in your core, you can definitely make it worse, which could make the postpartum period that much harder to recover from.
Right, right. So definitely, if anybody who's watching, or if you know someone who has more of a deeper separation, then they need to go to their physical therapist who's knowledgeable about this. And if they're not knowledgeable, they should be able to refer out to a fellow PT. So definitely, that's a good point. Personally, I never really thought about that. What I learned in school was width. So if it's like 4 fingers, it's like, oh my gosh, that's too wide. You know, so I have to definitely remember, if it's deep and you can feel that transverse and it's smushy, no bueno.
Yeah.
So we got to start basic and working on that diaphragm transverse
Yeah.
activate.
And 4 fingers is big. And 4 fingers is someone I would definitely recommend that belly belt for, you know, just to give them some extra support until that starts to close up. But yeah, if you're at a 2, 2.5, 3, if it's really firm under there, then that's okay. That may be okay if you know how to manage that.
Right.
And so postpartum, you look for the same thing. Like if you're exercising, you look for that doming. So you look for that bread loaf popping out. If you're in a plank, just peek down at your abdomen. And if it looks like a loaf of bread coming down your 6-packs, then that's called doming. And that's just bad management of pressure in your core and bad recruitment of your TRAs. And then you could benefit from a PT to help you work through that.
Right. Yeah, definitely. And I think stemming down from not only the ab or the deeper ab muscles and learning how to breathe, but hitting the deep glute musculature, the hips, you know, obviously as you're getting ready for childbirth, you know, the hips and the pelvis have to become wider and loosey, right? So those muscles just don't know what to do when they have all that elastin that's kind of just rolling in there into the musculature and the tendons. So that's one thing that Eva and I worked on yesterday to show a little progression for her to work on stability. So I'm like a huge advocate of like bands now. I never used to use like the stretch bands that you would use like on assisted pull-ups, like those type of bands, not the therapy bands that we use in the clinic, but like the thin bands that give you a resistance from like 10 to 20 pounds. Oh my gosh. Like y'all need to just travel with those wherever you go, like for a home workout. Oh my gosh. So we kind of, you know, we've incorporated now some single leg work with some dumbbell resistance on top of the banded work. I got a video of that too, but yeah, so just kind of showing these nice progressions that postpartum as well, like, you know, it's not brain surgery, but you know, Eva's still gonna have to pay attention to her body and how she responds. So for sure, that's one thing that we're trying to build as we go too.
And pressure, the pressure management we keep referring to postpartum is so important too, so that you're not bearing down on the pelvic floor and causing pelvic floor issues like leaking. Like so many women talk about leaking postpartum. Oh, I pee when I laugh, I pee when I run. Oh, but my doctor says it's normal because I'm postpartum, but it's not normal, and it doesn't have to be. It doesn't have to be that way. Like there's help out there, and so I'm just so passionate about educating people and like getting in front of people and letting them know like it doesn't have to be this way. Like you can recover. Pregnancy is not an illness, like you said, but it's an injury. Like it changes everything. And then for 9 months. Right. And then, so it's helpful to have somebody who knows how to recover from that injury. Right. To prevent further injury. So
All
I'm
right.
just
That's
passionate about it.
Yeah, that's definitely a fantastic point because, you know, you're pregnant, you're training to be strong for and when that pregnancy occurs, right? So that the labor and delivery is easier. And even the cesarean section that may happen heals better and faster, right? So definitely. Definitely some great topics that we hit on today. You know, knowing the intensity level, right? Because it's tailored to you. I don't know what your level 5 is. When my level 5 is completely different than yours on my exertion level. So just really honing in on and knowing how your body responds to certain movements that you've done before, and then you've tried to do them during the pregnancy, and you're like, oh, this feels off. You know? So you know that, okay, I need to modify this. What's something that I can do? Okay, hey, Amy's the PT at the gym. All right, let me go see her. What's up? Hey, Kristen has her clinic down the road or works here or wherever. You know, I know her, you know, so let me reach out to her and see what she may recommend. So definitely. So, I messed up the video at the beginning, but that's okay. I posted it. But
it's good.
For those who definitely jumped on and are still on right now, thank you for joining us. Again, Kristen is a local physical therapist here in the Matthews area. So, you know, if you guys need, go ahead.
Yeah. Amy can get you in touch with me, or my Instagram is K Heatbrink. I don't know if they can see that, but it's KHIETBRINK. I guess I could type that in.
Yeah, and I can leave your info on there as well. Yeah. Yes. So definitely.
Well, that's how you can get me on Instagram.
Right.
Oh, I don't know how to get back off of that. Oh, that's weird. Can you see me anymore?
I can still see you, yeah.
Okay. I can only see my eye.
Okay. All right, so it's already been 30 minutes because I messed up the first video. So, but yeah, you know, if any of you guys have any questions, definitely send us a direct message or reach out to one of us, and you know, we can kind of collaborate together and help each other out. So yeah, and if there's any other topics to kind of speak about, you know, my topic of the month is going to be pregnancy and training and CrossFit, and you know, what to look for, what not to look for, things maybe to avoid. So I'll be talking more about that the remainder of the month. And topic of the month next month on my list will be plantar fasciitis. So for those who may be experiencing that, be on the lookout for that. So,
cool.
Cool.
Maybe we could break down a couple CrossFit exercises.
Yeah.
And show the modifications that you would do for the pregnant woman. Maybe.
Yeah, definitely. Yeah, for sure. You took the thoughts that are going to be rolling out here in the next 2 weeks. So yeah, definitely.
Oh, there you go.
Yeah.
Stay tuned.
Awesome. Cool.
All right, cool. Thank you for having me.
Yeah, definitely. And, you know, reach out to us if you guys have any other questions. And if we don't know the answers, we certainly will find out someone who will, and we can direct you down that pathway. So, all right, cool. Well, thanks for joining, Kristen. And
okay, thanks, Amy.
We will talk soon.
Okay, sounds good. Bye.
Bye, guys.